Good health throughout life depends on preventive measures, early medical care, and community involvement. Globally, non-communicable diseases like diabetes and hypertension cause 74% of all deaths, according to World Health Organization. In Africa, infectious diseases such as malaria and tuberculosis remain significant, but non-communicable diseases are on the rise. In Nigeria, over 20% of adults live with high blood pressure, while maternal and child health indicators remain poor. Nigeria accounts for over 12% of global maternal deaths. Achieving good health from childhood to old age requires strong community health systems, vaccination, mental health awareness, and of course, government policies that prioritize health. We'll be discussing good health from cradle to grave and how this is our collective responsibility with our expert on your favorite health TV talk show, The Physicians. It's another day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and of course, with me on this show, I always have my co-anchor, and she's no other person than the beautiful and amazing.
Thank you. My name is Dr. Martina Admire. Welcome to The Physicians, where your health is our business.
And will always be our business. Today we are discussing about, cradle to grave, good health. How is it our collective responsibility? And you said something, before we came on, said that, is there anybody that has good health in Nigeria? May I have good health too?
I have good health. Actually, to me, having good health is a matter of a choice.
That is it.
You have to be very intentional about having good health.
Yeah.
So you are who you want to be.
Yeah.
Health.
And that's why lifestyle medicine is a very important part of us now, because the truth is that if you look at generally, let's fight diabetes, fight hypertension, fight maternal, all those, when you look at your life, your lifestyle, what are you doing on a day-to-day basis? And they don't necessarily have to be, many times we talk about it, people will always be thinking about money is about good. Yes, money plays a role in achieving good health, but what are you doing in your own little corner, in your own way, that you do not need money for? For example, exercising. Do you need money for that? You don't need to register for a gym now.
At all, you don't. In fact, for those that even buy the gym equipment things, I think most of them really.
I mean, that was up.
Yes, most times you find it.
I don't go.
You use the wardrobe they have paid. Just 1 week or so, they'll.
Yes, every week.
So, but now talking about good health from cradle to death, right?
Yeah.
I believe that from cradle, from the time we are born,
Exactly.
that is where it starts.
Exactly.
The parents have to do that until the child begins to take off. It is not when you are an adult, when you are past, that is when you want to now
Take
be
care
more
of.
conscious. It is what you do as a child.
Let me give you a typical example.
determines.
For those of us, some people, as a child, we're not giving meat. It's this, what they call that thing? 100, I mean 1001. Then now you're an adult, you have money. You want to take care of all the abattoirs, you want to eat all the meat, forgetting that as an older person, you need, yes, like especially red meat.
Yes, that's anything you don't
So those are the things that truly we need to preach and talk about.
I can't wait to discussing this topic with the guests, because there are a lot of things that people don't know.
Yeah.
That as you are aging gradually, there are certain things that the body don't even use
Exactly.
anymore.
Yeah.
And you need to use some other supplements
to take care of it.
And as a child that is growing, there are certain things that the mothers need to also
They must milk,
Yes.
proteinous food,
Breastfeeding. The
feeding.
importance of breastfeeding. When I talk about breastfeeding, I get very excited.
Hold it. We have an expert coming into the house and definitely will tell us a whole lot about, this collective responsibility, how we can achieve good health from cradle to grave. We'll be right back after this time out. Do stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, you jump back supplement for you and me. In your body. body. Eh, that I fight you.
Darabite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darabite from LB Pharma. Darabite. Love yourself.
Welcome back. If you are just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. With us in the studio today is an amazing guest, and he is no other person than Dr. Festus Oshoba. He is a consultant ophthalmologist and a public health physician, and also the Chief Operating Officer, Ladkem Eye Hospital. I'll be coming back with more about him, but right now, yeah, welcome on board, sir.
Thank you very much. It's
You
good
look,
to be here.
you look very glamorous.
Thank you.
All these things on you, what? I know that one signifies Nigeria. The other ones, this one signifies Medical and Dental Council. What about the other ones, sir?
Well, I'm a member of the Guild of Medical Directors of Nigeria.
Awesome.
Now, I'm also an ophthalmologist.
Yes.
And this one shows I'm a fellow of the Challenge for Administration and the immediate past president.
Wow.
Well done.
And then this other one shows that I'm a member of the Medical and Scientific Committee of the Nigeria Olympic Committee.
Wow. You know, on this show, we always bring you the very best. He is more than just a physician. And that's why this topic today is very crucial. We're talking about good health from cradle to grave, and of course, our collective responsibility. So for people out there, because we want to know in simple terms, what are we talking about? Good health from cradle to grave. You know, our collective responsibility. Break it down for our viewers, and because they are all there waiting to know what is this big word? How can they relate and start taking necessary actions?
Thank you so very much for this question. First of all, before we can talk about good health, all of us will know about good, better, best. Now, so let's lay emphasis on health. Every one of us, we have our own definition of what health is, and we look at it from our own different perspectives. But let me look at it from the perspective of the World Health Organization. The World Health Organization emphasizes two main things. It says health is a state, and it's a state of mind, a state of complete physical and mental well-being of an individual, and not just the absence of disease.
Awesome.
And when we now say from cradle to grave, actually, I like to break it down. It's actually from inception. Because let's look at it. We become who we are when the egg of the woman and the seed of the man meets. And then it becomes domiciled in the woman as a carrier for 9 months for incubation. But I can tell you something. So if, for example, a lot of women now, because of education, they are married in their 40s and so on. But we do know that many children that are born to mothers and even fathers of older age group have a tendency to have certain diseases.
Okay.
You know, like some of them may be born and they have mental issues. And so they have diseases that occur because you married late and you gave birth late. Okay. But of course, you can now correct that. If you now do in vitro fertilization, you can find out whether that baby is going to be healthy or not.
Okay.
The other thing is that when the person is now forming inside the womb, the mother can acquire some infections like toxoplasmosis, which will actually affect the eye of the baby and make the child to be blind as the child is born. The other thing we need to know is that all of us are a product of nature and nurture. So when we talk about nature, we are talking about the genes that we inherited from our parents. So sometimes there's a controversy when you say an albino in the family. It's possible that that been in the generations.
Yeah.
So the characteristics of how tall we are, how short we are, our physique, in fact, our eyesight, whether we are short-sighted or long-sighted, These are things that depend on the genetic combination. A good example is sickle cell disease. So if you are AS and you marry AS genotype, you have a 25% chance of having a child with sickle cell disease.
1 in every 4.
So when we say from cradle to grave, which means that even before you get married, you need to check your genotype. You need to check your compatibility with that person. If you are short-sighted, don't go and marry somebody who's short-sighted. Because your glasses, when you are wearing it, they will call it the bottle. It will be so thick that you will not like it.
Check all the tests.
Yes.
You were saying that they should take, all those into consideration. So it just simply means that the couples, people that want to get married, right? They have to go and do some
Tests,
investigations. Really detailed investigations.
Yes.
That is, you don't think that is going to be too serious? But we're talking about short-sightedness. Just because of that, I want to get married, I'm short-sighted, I have to go and check if that my
Prevention is better than cure now.
Prevention is better than cure. If you're talking about, for instance, sickle cell, that is understandable.
Or their blood group, or their thalassemia,
Yes. But
HIV status, and all that.
We're not scaring people, okay? It's good to be able to check such things, okay? But let me divert now from cradle to death. So what will be the health outcome? What will be the health outcome if these individuals do not check?
Yeah.
So the truth now is that you now inherit the gene to have a short lifespan or to have cancer.
Okay.
My trainer and my teacher, he died at age 50 from cancer. Okay. And his own father died at age 50 of cancer.
Okay.
In fact, in some of my relations also, they've had some cancers of the cervix and all that.
What are those things that Nigerians at different stages we should know about when we talk about good health as a collective, responsibility?
Thank you so very much. So most of the things that are really very important to us in life, they are free. Like the air we breathe is free. But you will not know the cost of it when you have a COVID-19.
And you have to take oxygen.
And you need to take oxygen, and you know that really God is good for us to be breathing in oxygen free of charge. So we have childhood immunization. So tuberculosis is a disease that we are trying to really eradicate in Nigeria. So if you don't want your child to have tuberculosis, as soon as the child is born, within a week or 2 weeks, take BCG vaccination. That prevents tuberculosis. So I've seen patients, people who had tuberculosis, and it affected their eyes, and they became blind from tuberculosis of the eye. Wow. So please, you can prevent poor vision by just taking that vaccine. Then we have diphtheria, tetanus, and pertussis. Now, it's a whooping cough. So when the child is whooping, sometimes they have bleeding in the eye. It can cause blindness.
Wow.
Sometimes it can cause death. So if we don't want to lose our child at an early age, they need to have this vaccination so that they can survive early childhood whooping cough. Also, we now have measles, malaria vaccine, mumps vaccine, and rubella virus vaccination. Thank God that now there is a vaccine for malaria.
Yeah.
So when it's readily available, we all should aspire to take it. But before then, we have the measles vaccine. As an ophthalmologist, I've seen so many children blinded from measles
infection.
The eye.
Which is
By
preventive.
just taking the vaccination, and measles can also kill the child. So you want your child to be not only alive, but to be seeing well, not to be disadvantaged. So take measles vaccine, please. Also mumps. The mumps virus, most of us are not aware. If mumps affects your child, the cheeks will swell. In female, it may cause very little problem. In males, if they have mumps, it affects the testes and destroys the testes.
Yeah, fertility.
And he finds out that the boy is infertile because of mumps. Why do you need to give, and then we now begin to go from prayer house to prayer house looking for
something that was preventable. And the vaccine is even readily available.
And it's also free.
And it's free. You're right.
You see, so we also have rubella virus. Rubella can give rise to abortion, and it can also give rise to blindness. So why do you want your child to be blind? Please take this vaccine. They are very important. We also have the Haemophilus influenza vaccine, which is available, hepatitis B vaccine.
Yeah.
Because many people, when I was in medical school, a lot of people had cancer of the liver. So if you take this hepatitis B vaccine, you prevent cancer of the liver, you prevent damage to your liver, and you live a very healthy life. It's very, very important. We also have the rotavirus.
Yeah.
Children, especially I'm a Yoruba man. So when your child is growing up and is having frequent stooling, they say it's because it was his teaching period. It's not lie. It's not true. It is due to rotavirus. So if you take rotavirus vaccination, your child will grow healthy without having diarrhea. Frequently, which can also lead to death of the child. And also we have pneumococcal vaccine. For adults and adolescents, you take a booster dose of tetanus vaccine, diphtheria vaccine, and then also especially for female, every girl child should have human papilloma virus vaccine.
Yes, from age 9 to 14.
From age 9 to 14. Look, this thing is not a joke. I have seen it in my own family. From experience, with the mother having died from cancer of the liver, and the first two daughters died from cancer of the cervix. This thing is died of cancer of the cervix, and the first two daughters also died of cancer of the cervix. This is something that is happening. It's life. So by taking this vaccine, you prevent cancer of the cervix. You have a good woman that will nurture us and make us grow into a better and healthier nation. And then you also have for influenza vaccine for colds, which is everywhere. And then if you are 65 and above like me, you need pneumococcal vaccine. You also need all of us need shingles vaccine. So, because in fact many people come to me who have these shingles in childhood, and when they get to adulthood, it affects their eyes, causing pain and blindness.
Yes. So it's always good that when it comes to things like this, and time is never really on our side when we are discussing very, very important topics like this. But before we let you go, sir, I want you to speak to one Nigerian. I know we are over 200 million Nigerians, but just take it that you are speaking to that one person right now on what to do today and days to come on how to improve their health, because we're talking about collective responsibility on what. So what is that 1, 2, 3, 4 that you want to let Nigerians know how to improve their health to be better from cradle, of course, to grave?
The most important aspect of health is your mental health.
Awesome.
So all of us are spiritual beings, we are emotional beings. So your state of spirituality and emotion must be right.
Okay.
So if somebody offends you, you get angry unnecessarily, your blood pressure will rise. So you need to take it easy and look at the sunny side of life. And once you have done that, you have already prevented some degree of hypertension. The next thing is expectation. Don't expect too much from yourself. Because blessed is he who expects nothing, for he shall not get disappointed, and he shall not develop hypertension. So when everybody's talking about Dangote, all of us want to be like Dangote. But excuse me, even Dangote, what can he eat?
Right.
Only very small. I'm sure you eat better than Dangote. So the issue is that it's not about food, it's about grace.
Yeah.
So let us be contented. The next thing when we are contented now is, let us always look at things the sunny side of life. We call this perception. So look at things that happen to you and look at it that for all of us, good things will happen, bad things will happen. So how do you do it? If things happen, you can withdraw from them if they are not so good. You can adapt to them, or you can recreate them. The next aspect is now your nutrition.
Yeah.
In terms of nutrition, as you get older, you have to reduce the amount of carbohydrate that you take. A lot of us will take a lot of eba, and we take a lot of rice. I love eba and I love rice, but I stopped eating it routinely because I found out that if you are eating eba and rice, you are likely to have embarrassment.
Embarrassment.
So, because eba will give you high blood sugar level, rice will give you high blood sugar level. Reduce the quantity of these things and go for more like fruits. Like now, the way they take in Lasepo, go for the draws, for the vegetables. And also eat in moderation.
Good.
Cucumber is good to snack on. We have garden egg. We have so many fruits and vegetables. We have yellow fruits.
Yeah.
We have palm oil. And these are things that are rich in vitamin A, which helps the eye to grow. They also help your muscles and every part of your body. Then also, we have oxidative stress. So for oxidative stress, you need to take natural antioxidants.
Okay.
And there are so many of them that are in our environment, in our foods, in our vegetables.
Thank you so much.
Let us, whatever one we can afford, let us take them so that we can live a healthy life.
Yeah.
And you just go to the doctor for checkups, and
Exactly.
everybody is happy.
Everybody
And
happy. Yes.
we can live healthy life from
Yes.
cradle
to grave. Thank you so much. It's obvious we are going to bring Dr. Festus Oshoba here because there's a whole lot that he hasn't even unpacked. Thank you so much, sir, for this beautiful reminder for some people, and for some people getting to know that these things are important, how to take care of yourself from cradle to grave. You do not have to wait until boom, fire brigade approach and you are running kitty kata to the doctors. There's a whole lot that you can do to prevent those diseases even before you were born, because of the checks you can do, medically before you even get married. And to our viewers out there, you don't want to have embarrassment. Hear what our experts say. Too much rice, too much embarrassment on the way. Please make sure that you eat healthy. There are always fruits and vegetables in the season, because when we talk about fruits and vegetables on this show, people will always believe that we are talking about things out of order. No, in this current dispensation, which fruits and vegetables are available, those are the ones we want you to focus on, so you do not have to break the bank, because nutrition is very important, but most importantly, manage your stress, manage your expectation, look at the sunny side of life for you to be healthier, wealthier, and of course, happier. Until next time, my name remains Dr. Mimuna Yusuf Kadri.
Well, Dr. Oshoba, thank you very much for coming. I don't want to just say anything because you have actually cracked it down. And I really appreciate you. We look forward to seeing you again.
Yep.
And to our viewers out there, with respect to all that Dr. Oshoba has said, all I want to just emphasize on this, your lifestyle, exercises. I've always said it and I will always say it again. If we put the benefits of exercising as a pill to be the best soul pill in the world. On that note, I want to request and ask that you follow us on our social media platforms. Instagram, you just go to our YouTube page. You will say, oh, we have over 250 episodes. You can actually binge on them. A whole lot of information is being passed from the physicians. My name remains Dr. Martina Agbere. Till next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.